Hello, everyone. Thank you very much for inviting me to present here. It looks like a potentially good meeting. So our work has been looking at various conditions of the developing brain. And in particular, we've been looking at this condition, which is hydrocephalus. It's fetal onset hydrocephalus. Babies born with big heads, water on the brain, it's called. In Pakistan, this affects, in Lahore, where we're working, 1 in 200 babies. In northern Pakistan, it affects up to 1 in 100 babies. And that's just one condition that's affecting the brain. Currently in the West, the treatment for this is to stick a needle in the head. This drains the fluid through a valve and down to the tummy. And this stays in for the life of the baby. In Pakistan, it's almost impossible to have the theatre time to treat all the babies in Lahore, where we're working. They get 90 to 200 babies a day with these conditions. So they can treat 3 or 4 in their theatre time. So it's an almost impossible situation for them. So if we move along, this is the situation in Lahore Hospital. They have so many babies, they get 90 babies a day while I was there. And there are 4 or 5 babies per bed. And you can see the enlarged head, the sunset eyes, which is due to pressure on the optic nerves, and in various states of treatment. This one has had a shunt. This one has had a shunt. You can see the hair is shaved here. These 2 babies have got external drainage implanted for the moment. So a huge problem, really. That's just one. In our research on this condition using this animal model, so here you've got a normal rat and a sibling that has hydrocephalus. You see there are 2 brains, so you've got the same fluid accumulation as the humans. And what we find in this brain, people assume this was brain damage, but it's not. It's a developmentally arrested brain, so the brain is not developing. And what we discovered is that the cause of this is a composition change in the brain fluid that stops the cells dividing. So this is a concentration dose response curve for CSF from this brain on cells growing in culture, and only 10% addition of this CSF to cells growing in culture, they stop dividing. They don't die. So in this brain, we see no cell death. And what we see is that the fluid is preventing the cells from dividing and completing development of the brain. And we see this condition in other neurological problems. So in autism, which is a huge problem worldwide, counts for 1 in 60, up to 1 in 50 babies born. You see this fluid accumulation is outside the brain and also inside the brain. You see enlarged ventricles, just like hydrocephalus, but it's not the same presentation. These babies do have bigger heads, but it's stabilized at a certain bigger size. Okay. And this is schizophrenia. You see a lot of cases of schizophrenia, and you see that the more severe the schizophrenia, the bigger the size of the fluid space within the head. Okay, and this is bipolar. You might consider this a simple neurological problem, but again, compared to normal brains, they have enlarged fluid space, both inside and outside the brain. And we recently have been working on Alzheimer's disease, and you find the same thing in this condition. So early events in the disease show that as the severity increases, you get enlargement of the fluid spaces within the brain. So when we analyzed what was going on in terms of the fluid composition, we found that there was a folate problem. So you all know about folic acid and prevention of spina bifida and neural tube defects. But in this case, there was a different folate problem. So folic acid is here. It's an artificial substance, man-made. Food folate is this one here. It's 5-methyl tetrahydrofolate. This is what you get from food. So you see they're coming in at 2 different points in the cycle. This is the rate limiting step of normal folate metabolism, which requires B12 and homocysteine. Homocysteine converted to methionine, and that conversion fuels the production of methylation pathway, as well as this one. I'll show you more detail later. So tetrahydrofolate goes to both sides of this equation, and what you see is that folate metabolism is absolutely critical to making the two components of DNA, pyrimidines, purines here, and also in making neurotransmitters. It makes nitric oxide, so cardiovascular problems, neurotransmitter problems, deficits in neurotransmitters and neuropsychiatric conditions, and other things are down to folate metabolism. I'll show you the details of that later. So what we found in these conditions is that this protein here, FDH, is missing in the babies that are affected by this condition of hydrocephalus. It's one protein missing in the CSF that's required for the folate to enter the cells. So they're basically deprived of folate, even though there's enough folate in the CSF, they're deprived of the folate by this missing protein. And we found this in many different conditions, and more recently we found it in Alzheimer's, but I can't tell you that at the moment. So fetal onset hydrocephalus, babies born with is missing this protein. So this is post-birth infection-induced hydrocephalus. This protein is missing in the brain. And in birth asphyxia, big problem in Pakistan, this protein is missing in the brain. So birth asphyxia, 30% of those babies go on to develop hydrocephalus. 100% of those babies develop neurological problems, some of which are quite severe in terms of cerebral palsy. So I think that all of these conditions are subject to a folate issue. And what we did with our rat mothers was to feed them folic acid, the standard folate, and we also gave them tetrahydrofolate and folinic acid to compensate for this protein. We gave them also a combination of these to both sides of the missing protein. And we got a surprising result, and that result is that if you give them folic acid, you get more of the babies born with hydrocephalus. So we're giving high dose folic acid, and we're getting more babies born with hydrocephalus. And in Pakistan and other countries where the minimal dose for folic acid is 4 milligrams, 5 milligrams, you see a greater incidence of these conditions, and you also see more severe incidence of these conditions. So the World Health Organization recommendation for 4 to 5 milligrams in areas of endemic malaria is actually producing more incidence of these conditions and more severe types of these conditions. If you give the natural folate, so this is artificial folate, if you give natural folates, you get a decrease in incidence. And if you give the combination, you get a huge decrease in incidence. So going both sides of the missing protein, we fix the problem. Not only that, we can treat them at birth. So here's a normal rat baby. Here's one with mild hydrocephalus, and here's one with severe hydrocephalus. 2 injections of folate after birth, and this one has gone to normal. This one has stabilized almost normal. So we can fix this condition. They don't need the brain surgery, okay? So this is more or less my last slide. It shows the complications of folate metabolism. So we focus on folic acid, which is the wrong thing to focus on because it's an artificial man-made substance. It's good for spina bifida prevention, but only at low dose and only given before you get pregnant. So most women don't know that you should be taking this 3 months before you get pregnant, which is the reason why we're going for flour fortification of folic acid, so that the whole population is getting the folic acid that they need. And interestingly, in the United States, where they looked at their 15-year effects of folate fortification of wheat flour, they found 2 very interesting things. The first is that they got a reduction in spina bifida, which was their target. They also got a reduction in congenital heart defects. They got a reduction in cardiovascular problems, and they got a reduction in cancer. So folate is really important to prevent these other conditions as well, but the fortification strategy gave them a dose less than 400 micrograms per day. So it has a benefit at low dose, but it definitely doesn't have a benefit at high dose. So looking at how folate is doing that, if we look at the normal folate, this is food folate, it's required to go through the whole of this cycle, but it also comes down here with vitamin D3 and B2 to produce or fuel the BH2, BH4 cycle that produces nitric oxide, So that's the cardiovascular problems sorted, and to produce neurotransmitters, particularly serotonin, dopamine, noradrenaline. So attention, mood disorders, schizophrenia, bipolar, all these conditions could be down to simple folate fault. And then methylation, so producing methionine in this rate limiting step comes down to this SAM, which is a methyl donor. It's a universal methyl donor, and that's required for all methylation reactions. So without methylation, your DNA genes don't work properly. You can't switch them off. And also this pathway comes down to acetylcholine through choline acetyltransferase. So it may be responsible for the initial loss of acetylcholine in dementias and Alzheimer's. It also comes around here via homocysteine to glutathione. Glutathione is really important to remove toxins from your body. So detoxification pathway is also dependent upon folate metabolism. Here, you've got the two halves of DNA synthesis, so you need folate for that. And you can see that all of these reactions not only require folate, they require other vitamins. So you've got B6, B3, B12 here, you've got B2 here, you've got D, and you've got various other requirements such as iron, magnesium in particular, calcium, and other minerals are required in these reactions. I've just shown a few here. So my take-home message is that cerebrospinal fluid, the brain fluid, is really critical to normal development. But more importantly, what the brain fluid is doing is supplying these key nutrients to the developing brain, but also your brains as adults. You need this nutrient supply system, which is the brain fluid inside your head. A drainage problem of any kind, so if you were to smack me on the head and I had a minor inflammation or hemorrhage, then my drainage system is obstructed. Consequence of that is that the folate system drops out, and I'm now heading down the road of dementia, actually, or various other horrible conditions. So we need to maintain our drains open, and the best way to do that is with combination folate therapy, but not folic acid, okay? So our recommendations are that fortification is essential. Folic acid is fine at the proposed low levels, but for higher level treatment and prevention of other cerebral cortex neurological problems, you need to use a combination of natural folates. Not only that, folates don't work on their own, and you need the other components, including minerals, but also vitamins. So addressing these hidden hungers is not going to be successful with a single nutrient mineral target. We have to ensure that the balance of nutrients and vitamins that we normally get from eating natural foods is presented to us. And the problem is that in processed foods, all of these components are lost. So I like to ask questions of my students. I ask them, you know, if you've got a McDonald's burger in your hand and you've got a homemade burger, both of them made with 100% beef or lamb, whatever you like. One has been processed, one has not been processed. You made it in the home. What's the difference? We cannot deny that both of those are 100% beef or lamb. So what's the difference? The difference is that the McDonald's burger keeps you hungry. You still feel hungry after eating a McDonald's burger. And this is a hidden hunger because your stomach is full, but your brain is telling you to keep eating. So this is the foundation of the obesity problem in the world, is that we're eating too many processed foods that are missing these nutrients that our brain knows that we need. The brain keeps us hungry in order to try and get those nutrients from eating more and more and more food. So these nutrients get lost through processing. Any processing of food, you lose these nutrients. So we need to think about that in thinking about how to develop proper foods for particularly poor populations. So that's basically a punchline. And this work, obviously, we've been doing this for the last 30 years, and we wouldn't have done it without an awful lot of collaboration. So we have a group in Iran, we have a Libyan group, we have a Pakistani group, and particularly the Children's Hospital in Lahore have been essential to our work. And UAF, Faisalabad, we have a social science network now looking at factors preventing access to nutritional support. It's really important to us because we're going to develop a nutritional supplement that addresses these brain conditions, but we need to know how to deliver it to a target population that needs it when currently they don't even access folic acid and they don't even know what the doctors are giving them. So we need to find a way of ensuring that when we have this supplement available soon, that we can get it to the right population. So that's it. Thank you very much for your attention.